You hear the word overdose, and you might imagine somebody struggling with their addiction on the streets. The reality? Actually much more grim than that. Unfortunately, because most overdoses are happening within homes. The numbers don't lie. In the first quarter of 2024, 47% of EMS naloxone patients were treated in a residence. The use of Narcan can and will save lives, and the training behind harm-reducing techniques like that is essential. Helping us to reinforce that message with you this afternoon is Peggy Geisler. You know her as the CEO of the Sussex County Health Coalition. Thank you so much for coming in and talk to us.
It's always a delight, Jimmy.
This is such a huge topic. When we say naloxone, we're talking Narcan.
Yes.
So what does Narcan do?
It reverses the effects. In other words, it blocks in the synapses, the uptake, which is all this complex terms to say it actually keeps it from continuing to operate in the body. So the chemical blocks it and the person is revived. It literally is a life-saving tool. If you don't do that, the person will die, right?
It's that simple.
It inhibits the uptake of the opioid.
Okay.
Right.
So training is a very important thing.
And it's easy training, like 15 to 20 minutes of your time. It's not like, remember when you go to CPR class and you're there for 3 hours?
Right.
And you should do that too, by the way, right? But if you administer this, which is basically a spray into the nostril, and you know they go through it, you can learn it online.
Right.
There are videos. You can go to Delaware Help is Here. It's on there. You can have someone come out. You can reach out to our organization. But 15 minutes, maybe 20 minutes training, you'll know what you need to do. You can get it for free. And literally, you can be, yes, I can save a life. You can save a life. And it can be in your own home. You know, parents say, well, no, you know, nobody, you don't know. One of your kids' friends could come home. You don't know. Everybody believes they know until it's too late.
So we're talking about that moment, the overdose right here, right now. What is available for recovery from opioid addiction? You
know, it's really, there is a lot of treatment going on in Maryland and in Delaware. If you do go to the Delaware Help Us Here line and you look, they will tell you which providers actually are taking new patients, who has open beds. But I think the really important is that we're starting to see more and more people in the state of Delaware checking themselves in for recovery. We're seeing more saves than we've ever seen. I think it's gone up like 168% in the number of people who have Narcan administered.
Right.
If you save a life, it gives a person a chance to recover, Jimmy. If they die,
you don't get the chance again.
And that, at the end of the day, it usually takes a while, seven tries on average for somebody to recover.
Wow.
But when they do, their family, their friends, if you were the one that administered it, probably thank you.
That's immeasurable. Okay, let's go back to Narcan training. It's easy.
It's easy.
Remind me again, do I have to have a certificate that I've been trained to administer Narcan?
No.
So how do we get the training?
So you can actually go to either Delaware Goes Purple, and we can also set it up. If you have a business and you want your company trained, we'll do it. The Narcan's free. Or you can go to the Delaware Help Is Here line online. They can also get you set up for training. And you can also get training. A lot of times there's local agencies like Brandywine Counseling, Impact Life. There's a bunch of other ones that will do the training for you as well. So you can get it in the community. You can get it for your company. You can get it online. There is absolutely no reason not to.
To not get it. And you're available to help save a life.
Yes, I can save a life should be yes, you can save a life.
Can save a life. Peggy Geisler with the Sussex County Health Coalition. Thank you again so much for coming in and talking about such an important topic. It's incredible.
Life saving is important.
Life saving is important.